I'm here with Dr. Jordan Shlain, founder of Healthloop. Dr. Shlain, thanks so much for being with me.
Well, thank you.
Can you tell me a little bit about your business and what inspired it?
Well, there's a lot of technology out there that does a lot of interesting things, but very few technologists understand what it is that doctors want. And I think a lot of technology thinks they know what doctors want. But I found that in my practice in primary care, back in the 2007, 2008, that I couldn't find anything that enabled me to communicate with my patients in an efficient way, that had some relevance and some context, that maybe that meant something to them. So I looked around and I couldn't find anything, and so I wound up building something, which in its simplest form was just to ask patients an automated email that would go out to them that said, Dr. Shlain would like to check in.
Sounds so simple.
And the check-in would say, are you the same, are you better, or are you worse? And they just clicked on a button within the email. So they never had to hit reply. All they did was clicked on that and I got the information of how they were doing. And then I would have a dashboard to understand the trends of how my patients were doing. And they could always send me a little sub-message within there. But I wasn't actually sending those emails out. It was pre-made.
It seems so obvious, and it's almost surprising that something like that didn't already exist.
Well, but sometimes the simplest ideas are the hardest ones to come up with, right? Because everyone's trying to overthink all this stuff. What's interesting to me about digital health in the iteration that it is in 2014 is that we're building all of these technologies to digitally represent the patient. So when you go to an electronic medical record or personal health record, what's in that record is a digital representation of you, and it's binary and it's digital, because all things digital are represented by zeros and ones. And so, you know, the talk that I gave, which is the continuity coefficient, which is the more handoffs there are between doctors and patients in healthcare, the more fumbles there are.
Right.
And data changes, and there's different kinds of data. Data, you know, they talk about big data.
Right.
That means lots of it. They talk about fast data, that means it moves quick. But if you break down data itself, there's constant data. You're a woman. That's probably never going to change, right? And if you had an appendicitis in 2012, that's never going to change.
Right.
So I can transmit that data relatively easily, and we're both going to agree that didn't change. But we talk about your hair color and where you live. That data doesn't change much, but it's a parameter. So that data changes maybe, but it's kind of fixed.
It's more mutable.
It's more mutable. But then you get to the delta data, or dynamic delta data, which is your thyroid condition, your blood pressure, stuff that's changing all the time. And so, you know, the more when you hand something off to somebody, the probability that the delta data has changed between the time they got it, you know, and the time that they see the patient exists. So you're referencing historical data, and how do you prevent degradation of the data between doctors' visits that when a doctor hands off to a patient? And then the last thing is what I call U data, and this is where I say healthcare is not digital and it's not binary, it's trinary. And it's trigital. And what I mean by that is that it's zeros and ones, yes, and it's also U's. And the letter U is represented by qualitative, not quantitative things. How are you feel, or are you afraid? Do you have a sense of accomplishment? All the humanistic components to what people do in the context of healthcare is just something that we do in life. It's not the thing that we are. But digital health is trying to make us a digital thing in health. But that's not what we are, and it's not who we are. It's a part of, and hopefully a short part of, and we hope that when the data gets transmitted from one to another, that we're including constant data, parameter data, delta data, and U data.
Wow. So a much more robust representation in the digital sphere for each patient.
That's right. But you can't really digitally represent U data. You can try to have a framework for it, because you may be bipolar, and I could put that in a digital chart. But are you depressed or are you manic right now? And by the time I got that,
dynamic.
It's dynamic. It's super dynamic, and it's also you could be well treated on meds, and your sister just got arrested or got in a car accident. Now you're depressed, but that happened like 2 minutes ago, and that changed so quick. It's already old. but now you're on your way. So I think just the way to think about how do we create continuity with less handoffs, and by understanding the specific data sets that exist within a patient, is not yet, no one's trying to crack that code. They're all trying to make everything zeros and ones.
Wow. So really the more human side of data. Thank you so much for speaking with me.
You're welcome.
All right, take care.
You bet.
This is Hayley for Medicine X.